Hello, greetings everyone. This is Dr. Satyan Nanda, a practicing neurologist in New Delhi. Today I shall be discussing a few words on the topic of epilepsy. Epilepsy, as we know, is a chronic condition which is characterized by recurrent seizures on two or more occasions. There are multiple causes of epilepsy, some of which include genetic causes. Epilepsy can also be caused by trauma to the brain. Epilepsy can be caused by various parasitic infections of the brain. For example, NCC, neurocysticercosis, is the most common cause of epilepsy in our country as an infectious cause. Other causes can include brain TB or a stroke in the past. Epilepsy needs to be identified, and there are multiple tests which a neurologist does to identify and to treat the epilepsy. Among them, the first and most important investigation to be done for any case of epilepsy is MRI brain to look at any structural causes of the epilepsy. After MRI brain has been done, then the clinician also requests for an electroencephalogram to look for any discharges which are coming from the brain. Epilepsy needs to be treated because the results of treating an epileptic patient are gratifying. There are multiple medicines which can control epilepsy adequately. If epilepsy is not controlled with medicines adequately, we can offer the patient a surgical rehabilitation also. After a surgical intervention, many patients do well. Then there are multiple other things also which can be done to better the life of an epileptic patient. For example, multiple lifestyle modifications and adherence to a proper sleep hygiene. Most of the seizures are precipitated by a lack of sleep. So in our clinical practice, we always advise the patients to have a good sound sleep and to avoid any other triggers for the seizures if they are able to identify, for example, any fever or any viral infection. Once these triggers have been identified and the patient has been compliant with the medicines, the chances of recurrence for seizures in most of the epilepsies is very small, and many of the patients do well on their medicines. Thus, to increase awareness of epilepsy on this epilepsy program, I would request all the patients to be consulting a neurologist and to follow the advice of the neurologist and take the medicines at the proper time and at proper dosing intervals. Thank you.